to improve this elevated sympathetic nervous systems in terms of treatment. Let's see if I got it right. You said that you start with the breathing, right? And then look at the thoracic, maybe do some thoracic mobilizations if you feel it's really stiff. And then you say, check the psoas and then the gluteus. Is that right? In terms of treatment, that's how you started, so we can just give the PTs a general idea of what to do in these cases, because I think that everybody knows they are connected, pain, stress, and trauma, but at the same time, we don't know what to do. We don't know how to effectively help them. So just we can help our audience here in practical terms. If you would describe a treatment to help in that type of situation, that's what you would do?
That is what I do. And the other thing I do is I really talk to the patients about, I mean, I think that Dr. Lowe's research, pain neuroscience, is very relevant. But I think we can do better. In addition to explaining that and showing that little video from Australia that they do, I think that we can do better. I think we need to explain to patients, look, I need to teach you how to do this again. I mean, I kind of think it's funny that we spend all this time teaching somebody how to activate their VMO. There's like a lot of muscles involved in breathing. We have a lot to work on there, okay? So yes, I put my hands on them. I do some quick stretching through the rib cage, and I show them. I, check the thoracic spine. I talk about scapular retraction, and in order to get, better expansion through that. And so that's where I start. I really take a look at their posture. I take a look at how they're breathing, and I talk to them about the muscles they're using. I have them actually walk and breathe and see how well that goes. Because sometimes people will just hold their breath, or I ask them to do the movements that are painful. I check, are you holding your breath when you do that movement? And then let's try breathing through that movement and let's see. So it's a lot more than take a deep breath. And I really try to get to therapists. You don't just tell people take a deep breath. People don't know how to take a deep breath. It's your job to teach them how to take a deep breath. And it's your job to know that it's thoracic spine, it's lumbar spine, it's psoas movement. It's, but that's where I start. And then if you get the diaphragm, if you get some good costal expansion, your pelvic floor will start to move again. And that's often very stuck in people that have very high stress, trauma, PTSD situations. I think it's interesting that research tells us that 50% of people with back pain also have PTSD. So
that's crazy. So talking about pelvic health, that I think for traditional PT, like the ones that treat more orthopedic problems, we are more scared about pelvic because that's not like our specialty area. So what do you do more specifically to the pelvic floor? Because you're talking about the core and how important is the pelvic floor in that situation. So do you do anything specific to pelvic floor, or just as a consequence of breathing, it improves too?
Well, I usually let people know that the pelvic floor will lengthen, not relax. Nobody wants organs falling out. The pelvic floor will lengthen just like any other muscle lengthens. Your bicep lengthens. Pelvic floors will lengthen in positions where you get your ischial tuberosities to move apart. And so deep squat. There are some positions that are attributed to yoga, but are not necessarily yoga, but yoga does them. But like the happy baby yoga pose, the child's pose in yoga, anything where you kind of have, or even just bringing knees up to chest like this and breathing deep, taking a diaphragmatic breath is going to help to lengthen that pelvic floor. Interestingly,